So this is going to be the last lecture in this unit for our circulatory system. So today we're going to be talking about the lymphatic system and the immune system. So even though they are two separate systems, they work very closely together, so it's easy for us to talk about them together. So first, we're going to start out talking about the lymphatic system. It's very similar to the venous system, the blood system, the veins. So very similar. So we'll talk about the lymphatic vessels and the circulation. And then we'll spend probably the majority of the lecture talking about the immune system and those immune cells, the lymphocytes, which are our main players of the white blood cells in the immune system. And then we do have some lymphoid organs and lymphoid tissues that we'll talk about and what their specific roles are in the immune system. And then we'll talk at the end kind of about our disorders and development. So if we look at them both together, what are the main functions of both of these systems? So here on the picture on the right is essentially a map of our lymphatic system and our lymphatic vessels. So what is the whole purpose of the lymphatic system? Essentially, it's to pick up any sort of excess fluid that may have leaked out of the capillaries. So we talked last lecture about the vasculature, and our smallest vessels are those capillaries. So we have capillary beds all throughout the body, all throughout all the different types of tissues, because that's where all that gas exchange and nutrient exchange is happening. And so what happens is we learned about that, the leakiness of those capillaries. Some are more leaky than others. So we know that the fluid is leaking out of the vasculature, out of those capillaries. And what the lymphatic system does is there are lymphatic capillaries that pick up that excess fluid. Most of it should be picked up by the capillaries themselves, so they leak out, but then they pick them back up. But any excess fluid is what we're talking about that the lymphatic system picks up. And essentially, it's going to make its way back to the heart. So it's going to try to deliver it back to the cardiovascular system and part of the blood. Okay. So what's the role of the immune system and how are they interconnected? Well, the immune system is trying to protect our body from any sort of foreign organism. So even if it's, benign, it still is going to be collected and destroyed by the immune system. So the components of the immune system are the white cells, the lymphocytes. Those guys are kind of the main players. They're going to be destroying any sort of foreign organism. But where we find the lymphocytes are in the lymphoid tissue. So they're going to be living in the lymphoid tissue, in the lymphoid organs, and that is where they're going to mount their defense against those foreign organisms. So let's talk about the lymphatic vessels first. So we said they're very similar to the venous system or veins, but what are they doing, right? So what is happening? So the picture on the right is showing a capillary bed. So we have our normal arterial blood coming in. It's going through that capillary bed, having that nutrient and gas exchange happening, and then it's going to exit out the venous system, right, after the gas exchange and nutrient exchange. And any of that excess fluid that may have leaked out is going to be picked up by our capillary, our lymphatic capillaries. So these guys in green. Okay, so these are all these lymphatic capillaries that are interspersed among that capillary bed. And so it's going to pick up any sort of tissue or any other substances around that area, around the capillary bed. Okay. And they are a lot leakier than the regular capillaries. So that means they can pick up just about anything. They're kind of like a vacuum cleaner. It's just going to suck up anything in that area, any excess fluid. And once the fluid is now inside those lymphatic capillaries, we call the fluid lymph. So it's not blood, right? So there shouldn't be too many blood cells in there. The blood cells should have stayed in the vasculature. So it's really just fluid and maybe proteins and any sort of pathogens, anything that else that may be there. So we call it lymph. And the lymph is going to be returned to the bloodstream, and so it only flows towards the heart. So it's very similar to the venous system in that way, in that it's going to only flow towards the heart, and the lymph is going to be deposited in the junction of two vessels, two veins in the neck, and we'll talk about that in a minute. Okay. So if we talk about the different types of lymphatic vessels, we talked about those lymphatic capillaries in the tissues. So they're the smallest vessels. They're going to pick up all that extra fluid and it's going to become lymph. They're very permeable. They pick up just about everything. And then it's going to send that lymph through these collecting lymphatic vessels. And they're pretty much just a little bit larger than the capillaries. But these guys are the ones that are going to run through lymph nodes. So we have collections of lymph nodes all around the body. So all of these collecting lymphatic vessels are all going to merge into lymph nodes. Okay, so we'll talk about lymph nodes in a minute. Okay. So on the picture on the right, let's start going through our picture so it makes sense. So here are our lymphatic capillaries picking up all that excess tissue. And what happens is all these collecting vessels, okay, are going to run into these lymph nodes. So these larger structures, they kind of look like little kidney beans. They are lymph nodes. So all these collecting ducts, collecting vessels, excuse me, are going to merge into a lymph node at some point, okay? So it doesn't matter how many, but it's going to hit a lymph node at some point. Because think of the lymph node like a filter, okay? So it's going to filter that fluid, and it's going to continue. And then all of those lymphatic vessels are all going to merge into a lymphatic trunk, okay? So they're going to merge into a lymphatic trunk, and then they're all going to merge into one of two lymph ducts. So the lymph ducts are the biggest, and essentially they are what are going to merge with some of the veins in the neck. Okay, so size-wise, we have smallest to largest. So just like we talked about the venous system, okay, increasing in size, and they're all going to merge together. So let's talk a little bit more about those lymphatic capillaries because they have some special features to them, okay? So they're blind-ended capillaries, meaning they have an end, right? So they're not a continuation like the capillary bed from the artery to the vein. We have a blind-ended tube, and so essentially they're just going to pick up fluid and anything else. So they have these little mini valve flaps which essentially allow the fluid to enter, okay? So they're very permeable and they pick up fluid, protein, and anything else such as bacteria, virus, cancer cells, pretty much just about anything, okay, they're going to pick up. Now we have specialized capillaries in the intestinal tract. So remember we talked about the venous system and how all the blood from the intestines are going to go through the liver first, right? The hepatic portal system. Well, I didn't complete that. I didn't talk about fat. So specifically fat, when we digest fat, it is not going to go into the bloodstream right away. It's going to go into these lacteals, and it's going to go into the lymphatic system. Because fat is quite large, the fat molecules are very large, and they can't be picked up by the normal capillary beds in the intestines. So essentially they have to be picked up by these lacteals, which are these specialized lymphatic capillaries. And so once that fat is in the lymphatic system, we call it chyle, because essentially that's just fatty lymph. So it's a little bit different than the other lymph that is picked up around the rest of the body. Okay, so we have these specialized guys in the small intestines. So here's just a schematic of how the difference is between protein and carb absorption versus fat absorption. So when we talk about protein and carbs, they're going to just go through the bloodstream. They're going to be picked up by the venous system, and they're going to go through the liver, through that hepatic portal system before returning to the heart. But what happens with the fat is the fat cells or the fat molecules are too large, so they go through this large lacteal that's in the intestine, and it's going to go through the lymphatic system first and go back to the heart that way. Okay, so fat does not go through the liver first, it goes straight back to the heart. Okay. So once the lymph gets into those lymphatic capillaries, it's all going to merge into these collecting lymphatic vessels. And these guys are pretty much going to run with the blood vessels. So they're very similar to blood vessels. They even have the same 3 layers or tunics that we talked about in the vascular lecture. So they're very similar to veins structurally, but they do have even more valves. So remember we talked about the function of valves in the vessels, in the veins of our limbs, and how that helps to return the blood back to the heart because of the low pressure system in the venous system. And so it's very similar in the lymphatic system. We don't have the blood pressure to back it. So these valves help bring the lymph back to the vasculature. And so with our little picture over here, I'm sure some of you guys notice these little lumps, and they call them kind of beads. So they look like beads kind of along the collecting vessels. So they look like these little beads, and essentially it's the valves. So essentially the valve closes and the fluid in front of the valve pooches out the side, making this kind of bead-like appearance. So very similar to the venous system, or very low pressure. So very similar mechanisms to get the lymph back to the veins in the neck. So how do some of these things happen is we have some skeletal muscle that'll help push kind of on the lymphatic vessels. Same thing with the pulsing arteries nearby. So they're running with those blood vessels, and when the arteries pump, they're going to help pump some of the nearby lymphatic vessels. And there is some smooth muscle in those walls of the vessels, and they can also help to contract a little bit as well and squeeze the fluid through. So all of those collecting vessels are going to run into a lymph node at some point, probably multiple lymph nodes. And these lymph nodes are kind of in clusters around the body. So we have hundreds of lymph nodes, and essentially they act like filters, like I said before. So they're going to essentially filter the lymph as it passes through. Okay, so it's going to have the immune cells sitting in the lymph node, and we'll talk about that in a little bit as well. And essentially when that lymph filters through it, if there's any sort of pathogen in there, any bacteria or virus, anything bad, then the immune cells can kill it or take care of it, right? So definitely like in these cervical lymph nodes up in the neck, right? When you get sick, they always feel for swollen lymph nodes because what happens is those cells in there are going to divide, the immune cells are going to mount an attack against that pathogen, and that lymph node gets swollen with immune cells, with lymphocytes. So we have these areas where there are collections of these lymph nodes, and we do have some deep lymph nodes in these three areas, and these are the ones I don't need you to remember. But we do have the superficial lymph nodes, and these are the ones that we can feel if they're swollen. So like the cervical region, that's a big one for doctors to feel in that area. Axillary lymph nodes in the armpit region. These are very important as monitors for like breast cancer. And then the inguinal lymph nodes as well, kind of around that femoral artery. So let's take a closer look at one of these lymph nodes. So we'll look at some of the microscopic anatomy, which I don't want you guys to spend too much time learning all these specific names, but I just want you to take a look at how these lymph nodes work. So essentially the lymph, the fluid, comes in through multiple afferent lymphatic vessels. And remember, afferent is adding or entering the lymph node. And then it's going to be filtered through these lymph sinuses. Okay, and again, the cortex of something is always going to be the outside. Okay, and then the medulla is always going to be the center or the inside. Okay, so they have these follicle centers or germinal centers full of lymphocytes. Okay, so anything purple, so these are out in the cortex. So we have these little germinal centers in these lymphoid follicles, and essentially that's where all those lymphocytes, those immune cells, are going to sit. So the lymph comes in, okay, and then anything that might be pathogenic, it's going to be picked up by those lymphocytes and destroyed. Okay, and then if it doesn't hit it in the cortex, it might hit it in the medulla before it exits out one of these efferent vessels. So there aren't as many efferent vessels to exit the lymph node because essentially we're converging, right? So we're going to take all of the little tiny itty bitty lymphatic capillaries, they're all going to merge into lymphatic vessels, and then these guys are going to merge into trunks. So we'll talk about the lymphatic trunks next, okay? So just like I said, all those collecting lymphatic vessels are all going to merge. They've all filtered their lymph through those lymph nodes. So now we're going to start merging into bigger and bigger vessels. So these lymph trunks are we have 5 major lymph trunks, and essentially 5 mostly paired trunks, okay? So kind of think your limbs, so coming from the limbs, coming from the head and neck, coming from the thorax, coming from the abdomen, so kind of your major areas of your body. So the lumbar trunks, think your lumbar region, it's going to be collecting it from that lower limb. So one on either side, that's why it's plural, right? So a pair of lumbar trunks. And then we have the intestinal trunk, right? So that's going to be picking up all that fatty lymph or chyle from the digestive system, from those lacteals, those specialized capillaries. And then we have the bronchomediastinal. So broncho, think lungs, mediastinal, think heart or the mediastinum. It lives in the mediastinum. And this is from pretty much the thorax, right? So heart and lungs in the thorax. And then we have the subclavian. Subclavian trunks are from those upper limbs, okay? And a little bit from the thoracic wall, but really think upper limbs, right? And then jugular, coming from the head and neck. Okay, so we have these different regions of the body that they're going to be draining all that lymph from. And then we're going to merge into two ducts, okay? So we said all of those trunks are going to merge into one of these two ducts, okay? So when we talk about the lumbar and intestinal trunks, they're going to merge together into this structure called the cisterna chyli. So the cisterna chyli is essentially just at that junction, and it's also going to be the beginning of the thoracic duct. Okay, so we have all the lower limb structures, all those vessels coming up and joining into this cisterna chyli. And once it hits the cisterna chyli, then it's going to become the thoracic duct. So the thoracic duct is going to drain, it's going to come all the way up here, all the way along the spine, okay, and it's going to dump into the junction up in the neck, right at the internal jugular and subclavian vein on the left side. So the thoracic duct drains that whole lower half as well as the upper left side of the body. So we just say it kind of drains the lower left 3/4 of the body. So it's draining the majority of the body, okay? And then if you're coming from the right side, so anything from the right head or neck or right arm, you're going to be going through the right lymphatic duct, okay? And so that is going to come in and merge right at the same spot as the left side at that internal jugular and subclavian, but on the right side. And so both of these ducts are going to merge right at that junction of the internal jugular and subclavian. And so now they're going to merge into the venous system, and they're going to return to that superior vena cava and be part of the bloodstream again, okay? So again, thoracic duct, 3/4 of the body, right lymphatic duct, only 1/4 of the body. So this just shows you kind of a better view of how those lymphatic ducts drain into the junction of the internal jugular veins and the subclavian veins. So if you see, here's that junction right here on either side, okay, of the veins. And then you see the trunk coming in, or the ducts, you see the trunks coming in into the duct, okay? So here's the thoracic duct coming in, and here's the right lymphatic duct. Essentially, the thoracic duct you could also think of as the left lymphatic duct. So we just, because it's so large and important, of course it has a name, right? The thoracic, because it essentially runs through the thoracic cavity. So as you can see, we also have a cadaver picture too. So here's the cisterna chyli, which is kind of just an enlargement here, which is the start of the thoracic duct. So it shows it here. And then essentially that thoracic duct continues up, all the way up into the junction at the internal jugular and subclavian veins. So now we're going to talk about the immune system and how it relates to the lymphatic system, right? We talked about them being very closely related and they work hand in hand. So the immune response is very specific. So it essentially is very good at destroying very specific pathogens, okay? And the lymphocytes are the cells that are going to do that. So lymphocytes are one of our white blood cells, but they are the main players of the immune system. So we also have some tissues and organs that we talk about when we talk about the immune system. And those we've already talked about the lymph nodes, right? So they're lymphoid tissue. And we've talked about the spleen here and there, the thymus, tonsils are lymphoid tissue as well. And then these kind of aggregated lymphoid nodules that we'll talk about in a little bit as well. They're in tissues, other tissues. And then the appendix. So I know I've had my appendix out. I don't know if anybody else has, but the appendix, they say, doesn't do anything in the body, and it does, but we just don't need it to survive. But the appendix is a lymphoid tissue. So I hit on this topic a little bit in the beginning of the class. What's the difference between inflammation or an inflammatory response versus an immune response? So an inflammatory response is indiscriminate, meaning it doesn't care what is causing the inflammation. It's going to respond no matter what, and it's going to respond very quickly. So it's rapid, it's acute, it's fast into that local area. And essentially the white blood cells that do this are our neutrophils and our macrophages. And so these guys are phagocytic, meaning they are going to eat whatever is there, right? They're going to eat and try to destroy whatever is there, no matter what it is. Okay, they're indiscriminate. They don't care. They're just going to attack. Versus the immune response is a little bit different. So it's a slower response. But it's very specific. So essentially, the lymphocytes that are targeted for that specific pathogen are going to come and kill that pathogen. Okay, so there are certain lymphocytes in the body that are trained to kill that specific pathogen. So these guys are really only the lymphocytes. The lymphocytes are the main players of the immune system. Okay, and I love that cartoon. So what is happening with the immune response? What are the steps that we take? So first, some sort of infectious organism is going to trigger the general inflammatory response, right? Our neutrophils, macrophages are going to come in and try to take care of whatever is there. But then the lymphocytes are going to kick in and they are going to be probably more effective at killing whatever that may be. Okay, so we have two different types of lymphocytes, B cells and T cells, and they work differently, but they are both lymphocytes. Okay, and we'll talk about the differences in a little bit. But lymphocytes are really good at recognizing a very specific foreign molecule on that pathogen, and that's called an antigen. Okay, so essentially, say you have, whatever this pathogenic cell is, whether that's a bacteria or a virus or whatever that may be, you have something that is going to have this little protein called an antigen sticking out of it. And it's kind of like a flag that says what it is, okay? And so the lymphocytes are able to recognize those little flags, those little antigens, and essentially say, hey, you're a bad guy, and I'm going to destroy you. Okay, so that is how these lymphocytes work. We'll talk a little bit more about that as well. So what are our two types of lymphocytes and how do they work differently? So we have these T cells, and the specific ones we'll talk about are called cytotoxic T cells. And these guys are going to bind to that, that pathogenic cell directly. If it's bearing that antigen, it has the little flag up. It says, I am this type of cell, and it's going to bind straight to it. And essentially what it does is it pops holes in it, and it causes the cell to self-destruct, okay? So that's called apoptosis, is when a cell self-destructs, Okay, so it's going to perforate little holes in it, and it's going to say, go destroy yourself. So essentially that's what's happening with cytotoxic T cells, and it's very effective against virus-infected cells and even cancerous cells. So these guys, of course, are, a lot of research is happening with T cells and how we can use it to our advantage to fight cancers. But B cells work very differently. So B cells become plasma cells. So when they're activated, they turn into these plasma cells, and the plasma cells secrete antibodies. So antibodies are just little proteins, and they are the ones that are going to go out and bind to that antigen on the bad cell. And essentially it's going to flag that cell for destruction. So some other cell is then going to come and eat that bad thing, such as a macrophage, because it's phagocytic. So then it's going to come get that bacteria that's flagged by the antibody and essentially destroy it. Okay, so this is very useful, especially for bacteria. Okay. So this is just a larger slide of what we just talked about, showing the different functions of the cytotoxic T cells versus those B cells, which turn into plasma cells. Okay. So how do lymphocytes develop? Okay, so we said all of our blood cells are going to be developed in the bone marrow. So yes, that's true. They do originate in the bone marrow, and then some of them are going to stay in the bone marrow, and some are going to leave and go to the thymus. So the ones that leave and go to the thymus are the T cells, and how we remember that is T for thymus, T cells. Okay. And the ones that stay in the bone marrow are the B cells. B for bone marrow are the B cells. And essentially what happens in the bone marrow and in the thymus is that lymphocytes mature. And what does maturing mean for a lymphocyte? It means that it's going to gain immunocompetence. So that means it's going to learn what is self versus not self, because obviously you don't want your immune system attacking your own cells in your body. So it's able to recognize a very specific antigen that we don't see in our own bodies, okay? So this is where autoimmune diseases happen in this process. If it malfunctions, then your body can attack itself in these autoimmune diseases. So normally you don't want that to happen, and so you tell your lymphocytes, okay, this is your own cell, don't attack it. This is a bad cell with an antigen, you can attack that, okay? And so they're mature after this phase, but they're not activated yet, okay? So they become mature in the bone marrow and the thymus. And then they go out into the bloodstream and into the different lymphoid tissues, okay? So this just goes through the step-by-step activation and differentiation of these lymphocytes, okay? So again, we said that they mature in the bone marrow and the thymus, okay? So they mature, and then they're going to go out into the real world, okay? They're going to go out into the bloodstream, into the lymphoid tissues, such as a lymph node, and they're going to be looking for that antigen, okay? So they're primed and ready to go, but they're not yet activated. Only when they find their antigen are they activated, okay? And we'll talk about kind of what happens when they get activated. Okay, so first, they're going to be mature, right? So first they have to gain their immunocompetency, and then they're going to travel around looking for that antigen. And after they encounter it, it's becoming activated. So that is what activation means. It's going to be in a direct encounter with that antigen. And what happens is because, there's a huge body to cover and a lot of tissue to cover, the macrophages and even dendritic cells, which are immune cells in the skin, these guys are actually going to present different antigens to the lymphocytes. So essentially they eat something bad and they carry that antigen and display it to the lymphocyte. So they act like these patrol cells for the lymphocytes and say, hey, look what I found over in this tissue. Is this what you're looking for? And then they tell them, hey, it's over here. And then that lymphocyte becomes activated. So what happens is that the lymphocytes proliferate, meaning they divide very rapidly once they're activated, okay? So they mount an immune response, okay? So they divide and become a lot of them, okay? So they produce these clones, be called effector cells. They essentially make a little army. And then they also produce memory cells, and we'll talk about memory cells in a second. So what do these clones do? So after that activation, okay, they're going to produce two different types of cells. The effector cells are essentially the army. So they're going to respond immediately to help battle whatever pathogen that may be, and then they die, okay? So B cells produce a bunch more plasma cells, and T cells produce a bunch of T killer cells and T helper cells. You don't need to know the difference between them, but they essentially proliferate more T cells. And then memory cells are the other cells they produce. And essentially what happens is the memory cells don't go to battle, they don't die, and essentially they wait in the body for another antigenic encounter. And this is the basis of acquired immunity, right? That's why we get vaccines. So essentially we introduce that antigen into the body so that our immune system can produce these memory cells, because with the memory cells, they actually are able to produce an even larger response the second time. Okay, so that's why you're able to then kill things a lot better, way more efficiently after being vaccinated. So this is just a blow up slide of how that proliferation of the clones happens. Okay. So it's just showing this is specifically B cells, but the same very similar thing happens in T cells as well. So essentially you're going to produce a bunch of plasma cells to secrete much more antibodies to have a response, but then you are going to produce a memory cell. So then the memory cell is then able to produce an even larger response the second time around, okay? So what are these lymphoid tissues? So we said that all white blood cells, even though they're produced and travel in the bone marrow and bloodstream, they work outside of the bloodstream, right? They work in the tissues. So the lymphoid tissue is where all of those lymphocytes hang out, looking for the antigen. They're waiting for some sort of antigenic encounter, okay? So there's two very general locations for this lymphatic tissue. And the first big category are mucous membranes. Okay, so any sort of mucous membrane, because it is the first line of defense when looking to the outside. Okay, so the mucous membranes of the digestive tract, urinary tract, respiratory tract, and reproductive tract. So all those have access to the outside, because where do you think a pathogen is going to be coming from, right? It's going to be coming from outside. And then we also have lymphoid organs as well. Okay, so those are going to be our lymph nodes, tonsils, spleen, thymus. So we have a bunch of different lymphoid organs as well. So let's go through those organs, okay? And the big thing is we have some primary lymphoid organs and secondary lymphoid organs. What is the difference? Primary means that they're involved in the production and maturation of lymphocytes. Okay, so that's our bone marrow and our thymus. So we only have two primary lymphoid organs. So they have nothing to do with actually fighting or activating anything, okay? They're just producing and maturing those lymphocytes. Whereas the secondary lymphoid organs have to do with activation. So these guys are going to be where the lymphocytes are sitting and waiting for those antigens, okay? So lymph nodes, right? So we said lymph nodes, going to be filtering the lymph, waiting for all the pathogens. They're going to be sitting in there, waiting for the antigens. The spleen, we'll talk about in a minute. Tonsils, so we'll talk about tonsils. Those guys are sitting in the pharynx, so in the throat, okay? And then these aggregated lymphoid nodules kind of throughout the mucous membranes, okay? And then essentially in the appendix as well as in the digestive system, waiting for anything that comes through the digestive system. And essentially they're just waiting, okay? These lymphocytes are waiting in these lymphoid organs, lymphoid tissues, waiting to come across an antigen, okay? And we talked about this reticular connective tissue before. So I said think immune system when I said, you know, this reticular connective tissue. So the spleen, the bone marrow, we've talked about reticular connective tissue, but all of these lymphoid organs and lymphoid tissues are have the reticular connective tissue framework. So let's start with the thymus. So this is where our T cells go to mature. So it's most active during childhood, right? So essentially it's where we learn what is self and what is not self. And so very active during childhood, and then it atrophies with age. And essentially it sits kind of right above the heart. So here is a cadaver picture. Here's a lung. There's our left lung. There's our right lung. And then the heart sits right here on the left. So essentially it's sitting right on top of the heart in the mediastinum. So if we look at the histology of the thymus, and it's very similar to our lymph nodes. So again, don't worry too much about the histology. It has a cortex and a medulla, an outside and an inside. And essentially, that's where all those lymphocytes are sitting. So anything with this dark purple stain is going to be a lymphocyte. So there's just chock full of lymphocytes sitting in that cortex, okay? So we already went through the lymph nodes a little bit with the structure of them. So essentially we have kind of these lymphoid follicles that contain all of those lymphocytes sitting in there waiting for an antigen. And the lymph nodes, this is where we get most of our antigenic challenges because the lymph is very good, the lymphatic system is very good at picking up pathogens throughout the body. And it's going to go through a lymph node at some point. So this is really where a lot of our antigenic activation is happening. Okay, so when they're activated, then they're able to destroy those pathogens. And just like I said before, we have those swollen lymph nodes because all those lymphocytes are proliferating and dividing. So you mount this huge response with all these soldiers, and the lymph nodes swell up. So the spleen is a little bit different from the rest of the lymphatic organs, okay? So it is the largest lymphatic organ, but it's very specialized in what it does. It filters blood, so I can't make that more clear. The spleen filters blood, not lymph. So the lymph nodes filter the lymph, and the spleen filters blood. So any sort of pathogen that has gotten into the bloodstream is going to be picked up in the spleen. Okay, so any sort of bloodborne antigen that gets to the spleen, it's going to get picked up there. But it also does something else. So not only does it take care of bloodborne pathogens, it also removes and destroys old or defective blood cells. So red blood cells, white blood cells, whatever that may be. Okay. So what it does is it phagocytizes, meaning it eats bacteria, worn out red blood cells, white blood cells, platelets. It also stores platelets, and don't worry too much about that. But it also is a big site of hematopoiesis in the fetus, which is interesting because we said, hematopoiesis happens in the bone marrow in adults, but essentially the bone marrow isn't quite developed in the fetus, right? So the spleen takes over that hematopoiesis in the fetus, okay? So let's look at the histology of the spleen. It's quite interesting. So essentially we have two main regions of the spleen. We have the white pulp and the red pulp, okay? So think of the white pulp as being the immune function of the spleen. So any blood-borne antigen is going to be destroyed in the white pulp. So essentially this is where the lymphocytes sit in these little regions in the white pulp. So if we look, here's the white pulp. Okay, so it's this circle of kind of darker tissue. Like here's another white pulp here, here's another white pulp here. And I know it's counterintuitive because it says white, but it's actually a dark spot because that's where the lymphocytes live and they're white blood cells. So I think that's where the name comes from. And then the red pulp is all the other stuff around the white pulp. Okay, so it essentially is the majority of it, and it's responsible for disposing of those worn out red blood cells, white blood cells, whatever that may be. And these are macrophages. Okay, so lymphocytes, okay, lymphocytes in the white pulp, macrophages in the red pulp. Okay. So now, these really aren't organs per se, but these are aggregated lymphoid nodules, meaning in other tissues, such as mucous membranes, there's going to be these little nodules of lymphocytes sitting there in the tissue, in the mucous membrane, waiting for that antigen. So these guys are called mucus-associated lymphoid tissues, or MALT. Okay, so they're going to be associated with any mucous membrane. Okay, and so these guys are sitting underneath that submucosa. Okay, so and it's going to be in any area that's going to be exposed to the outside environment. So what are our types of MALT? Okay, these aggregated lymphoid nodules. The first type is in the gut, so gut-associated lymphoid tissue, or GALT, but we also call them Peyer's patches, okay? And so they're mostly in the lower small intestine, the kind of distal small intestine. So that's what this picture is of as well. So if we look, we have a cross-section or the wall of the small intestine. Okay, this is outside, this is inside, okay, the small intestine. So then we have this region here, okay, that's kind of dark with these dark nodules, these dark circles. Those are the Peyer's patches, which are aggregated lymphoid nodules, okay? And then our appendix. So our appendix is essentially an aggregated lymphoid nodule. So it's just a bunch of lymphocytes in that little tube off the cecum. Okay. And then tonsils. So tonsils are mostly in the pharynx, and we'll talk about the different regions that we have tonsils. And they are in the opening to the nasal cavity, the oral cavity. So anything that's going in our head is going to go by a tonsil, right? So let's look at those tonsils. So they're the simplest lymphoid organ. So they're technically an organ, but they are kind of in this group of aggregated lymphoid nodules. So we have a couple different tonsils. So we have the palatine tonsil, which is associated with the palate, okay? Lingual tonsils for the near the tongue. And then we have pharyngeal tonsils, which are up in the pharynx, kind of in the back of the nasal cavity. Okay, so here are our three on the picture on the right. So pharyngeal tonsil up in that nasal cavity, palatine, so kind of near the uvula, and then the lingual tonsil. And a lot of people get their tonsils removed. So people that have constant tonsillitis, right, inflammation of the tonsils, they get them removed a lot of the times. And the palatine tonsil is the most commonly removed tonsil. Okay, so essentially these guys kind of form a ring around the pharynx. So any sort of pathogen that's inhaled or swallowed is going to encounter these tonsils or these mucus-associated lymphoid tissues. Okay. So now that we know how the lymphatic system and immune system work together to fight pathogens, there are some disorders of the lymphatic system and of the immune system. So let's first start with the lymphatic system. So we have something called a chylothorax. So if you think chylo, what was that? That was our fatty lymph and the thorax. So maybe chyle in the thorax. So leakage of that chyle into the thorax. So if that thoracic duct gets damaged at all, this can happen. Okay. Lymphangitis. Lymphangitis is just inflammation of those lymph vessels. So essentially, those lymph vessels can't return the fluid to the cardiovascular system, and we get swelling. We get lymphedema, and that's what this picture is over here. So you get very swollen limbs, especially in the lower limbs, and it can be quite dramatic. We see this in horses as well. So here is a picture from some horses. None that I have treated specifically, but I have treated multiple cases of lymphangitis in horses. And it's pretty severe, and they can be very, very lame. And you put them on antibiotics and anti-inflammatories and try to shrink their leg back down. Sometimes it returns to normal, and sometimes it doesn't. And oftentimes they get repeat cases of it. So now let's talk about some disorders of the immune system. So mononucleosis is a very common disorder. It's nicknamed mono. So a lot of people, especially in college, they call it the kissing disease. Because you have to exchange saliva or bodily fluid, and it's a viral disease. So it's a specific virus, the Epstein-Barr virus, and it attacks B lymphocytes. So you have a weakened immune system for a while, and it does go away, but it lasts a few months. And usually people are very weak and tired, and it can be quite dangerous as well if you do develop any sort of infections or anything while having mono. And then we do have lymphoma. So lymphoma, we talked about leukemia last time, right? And those are all the other white blood cells. But lymphoma specifically has to do with lymphocytes. So we have two types of lymphoma, and Hodgkin's lymphoma has to do with lymph nodes specifically. So it's cancer in the lymph nodes. And this responds very well to chemo and radiation. So the lesser of the two evils, because non-Hodgkin's lymphoma has to do with the development of lymphocytes. So essentially you have this uncontrolled multiplication and metastasis of these kind of undifferentiated lymphocytes. And it can be very, very dangerous because essentially they don't know self versus unself. They're not normal lymphocytes. So your immune system is crippled. And it can be much more fatal and does not respond as well to treatment. So as we age, our immune system definitely declines. So we have increased susceptibility to disease, which we see this, right? Older people tend to have weaker immune systems. You know, we're going through this right now with the coronavirus. And essentially the immune system just is less efficient at fighting pathogens. And essentially, it also decreases its ability to fight off cancerous cells or harmful cells, which is why there is a buildup of cancerous cells as we age. And so essentially, there's a steady decline in our immune system as we get older. So here are our learning objectives for this lecture. Okay, not too bad, fairly short lecture today. And next week we do have our exam on the circulatory system. So it's going to cover, you know, the heart, from the heart, blood vessels, and lymphatic and immune. So it's going to be very similar to the last exam online where we have 30 multiple choice questions. You guys will have an hour to take the exam, and each question will be worth the 2 points, okay? And then the next, we'll start Thursday then with the next chapter with the respiratory system for our last unit. Okay? Hope you enjoyed some of these fun cartoons that I like, and I really enjoy the immune system. And hopefully you guys are all staying safe, and I will talk to you next time. Okay, bye.